Today, in addition to registering the highest number of cases, can report that they are now spread in 35 various hospitals across the country. And out of these, within those 35, we have grown now into 7 in critical condition, 4 are on ventilatory support, while 3 are on supplemental oxygen. On another sad note, we have lost 3 more patients to the virus, bringing the total number of fatalities to 55. And I would like to take this opportunity to condole with the families of those who have succumbed to this deadly virus. All of them, the 3 persons, all had comorbidities. One had diabetes, the second one also had diabetes, while the third one had hypertension. And one with diabetes, second with diabetes, and the third one with cancer of the breast. The figures which we have shared illustrate the rapid rate of transmission in the informal settlements of Nairobi. This means that there is a ranging number of infections in these areas. We either live in those places, have a relative that resides there, or know someone else that does. So what does that mean? It means that this disease is now within the communities. Hii ugonjwa uko mtaani na hakuna mmoja wenu ambaye yuko salama. Hakuna mmoja wetu ambaye yuko salama. Awe ni yule anauza mboga pale sokoni, ama ni tajiri wa aina gani, hakuna mtu ambaye sasa anaweza kusema ati hii virusi iko mbali sana na yeye. There should be no falsehood or any false sense of security about the immunity to COVID-19. If the numbers in Eastlands are rising, it means the same is occurring elsewhere. And therefore, my appeal to all is that when, for instance, we conduct testing in an estate near yours, kindly volunteer yourself for testing. Knowing your status is very important, not only for yourself, but importantly for those who you will want to protect. I would like to make an appeal to the public transportation owners, drivers and riders. As you can see, some of the highest infections come from areas where public transport is the primary means of transportation. Yet, we have noticed that many have reverted back to their old ways of travel, disregarding social distancing rules and not obeying masking guidelines. Please let me remind you of the need to protect yourself and, as I have said, to protect others. You don't know who you are sitting next to. And from the figures we are getting, I think it would be safe to assume that the person you are sitting or standing next to is positive. Once you assume they are positive, you will not want to remove that mask because you will be protecting yourself. The increase in community infections is simply because of the increase in community contacts, and that is a fact. Despite all this, there is hope for Kenya. Even with this spike, we must give thanks that from an overall perspective, these infections are relatively low as compared to others, and particularly when it comes to the numbers of those who have succumbed to the disease. It is good to compare oranges with oranges. you notice is a high figure of 123, but there is also a high figure of the tested cases of over 3,000. So you have got to put it in perspective. And going forward, we are going to be trying to get you statistics to show what percentages, in addition to the actual figures, to show what percentage change there is month on month or week on week basis. We need not lose focus on our need for vigilance. That said, it is important to remind you that of all the diseases that exist, all have existed, none, and I mean none, has ever been as lonely as COVID-19. If this disease gets serious, and it is getting serious, it is just that we have been lucky so far. People die alone. They don't die as a group. So it is important for one to protect themselves. We will be visiting counties on continuous basis as a means of evaluating our national preparedness levels. Because collectively, county Mathare ulikuwa na watu wengi zaidi 33, na hii ni kusema ya kwamba virusi iko kila pahali. Hakuna mtaa sasa ambao hauna hii virusi. Ni kusema ya kwamba rafiki yako yule mnatembea naye, pengine huyu sasa ako na virusi. Ile bahati tuko nayo ni kwamba hata wale ambao wameshika hii virusi si wengi sana, wako hatarini. Tumetupoteza watu 3 leo hii. Hao 3 walikuwa na ugonjwa tofauti, walikuwa na ugonjwa ingine tofauti, lakini ni kumaanisha ya kwamba ukiwa na shida fulani, ukiwa na hypertension, ukiwa na virusi zingine na upate hii COVID-19, ni kusema uko hatarini zaidi. Kwa hivyo sisi kama Wizara ya Afya tutaendelea kusihi wananchi tufuate vile wadaktari wetu wanasema, tufuate yale masharti ambayo imewekwa na serikali, sana sana mambo ya kunawa mkono, mambo ya kuweka mask, mambo ya kukaa mbali kidogo na yule rafiki yako. Hata ukienda kutembelea mtu, si lazima mkae karibu sana, kaa mbali kidogo. Na pia saa hizo zote mnazungumza, wewe kuwa na mask na yeye awe na mask. Mheshimiwa Rais alisema juzi, akasema hatuwezi kuendelea na kufungia watu ndani. Na hiyo ni kusema ya kwamba tutategemea watu wenyewe binafsi. Tutategemea watu, hatuwezi kutegemea polisi kufuata watu ati wawe wamevaa mask. Hatuwezi kutegemea polisi kulinda wewe kutoka kwa mwenzio. Ni wewe ujilinde na mwenzio ajilinde. Serikali haiwezi kuwa na askari milioni 47 ati kila mtu mmoja ako na askari moja wa kumfuata. Hapana, sio hivyo jameni. Vile tunasema, Rais vile anasema ni kwamba tunataka kila mtu awe ni askari wa mwenyewe. Kila mtu. Ndio hii vita, kwa sababu ni vita na ni vita kali. Kila mtu awe ni askari katika hii vita ambayo tunayo. Hiyo sio vita, hii si vita ya serikali. Hii ni vita ya wananchi. Hii ni vita ya mwananchi binafsi. Na tutashinda kwa sababu kila mtu amechukua usukani wa kujilinda, kulinda familia na kulinda mwenzake. Kwa hivyo nimeshukuru sana na nimesema asanti.
Waziri, two quick questions. And this is in regard to the public appeal you are making. At one point,
ni nani huyo anazungumza?
Naitwa Ayub kutoka Ibru TV. You are calling for a public appeal, and it's worrying, isn't it, that even as you call for this public appeal and the commitment by the public, that largely a lion's share of the Kenyan population is not adhering to your own guidelines that you have laid out. And then two, today you have recorded the highest number, and the president on Saturday hinted at the reopening of the economy. Going forward then, isn't this a worry, or is it a reveal that the capacity the government has in testing and these cases therefore cropping up?
Yeah, good question.
With regard to mass testing, it appears it's through mass testing that you are able to detect the virus at a faster rate. Is there an approach on mass testing that you intend to take to ensure that you double or even triple the testing to ensure that you get all the positive cases as soon as possible? And the last question tied to that is about the reopening of the economy. You seem to paint a picture of an overwhelmed government in terms of implementing the laid down protocols. Then as a Ministry of Health, have you given a green light for the reopening of the economy, given that the number are now literally running wild? Thank you.
Right, thank you, Waziri. My name is Zainab Ismail from NTV. There is a case where there's a suspect has been charged with obtaining government PPEs through forged documents that are said to come from the Ministry of Health. And we'd just like to get a brief from you on if you're aware of that case and how far that has gone from the Ministry of Health. And is this probably linked to the more than 30 staff that you transferred last month due to involvement of misappropriation of funds?
Thank you.
One last question, sir. My name is Purity Musel from KBC.
Yes, Purity.
A follow-up on yesterday's concern at KU. At Kenyatta University Referral Facility, which is a government facility, there were patients that were yet to be released to go home, even after testing negative more than twice, because they had been given bills. One had about 136, another one had 86,000, and up to today, 3 p.m., they had not been released. Probably, is there a protocol of releasing these patients in government facilities, and how is it like? Number two is on the county preparedness. On the response of COVID-19, you may, if you don't mind, update us if all counties as at now have isolation and quarantine centers for COVID-19, because there are claims, especially in Kitui County, where some hospitals are let me not use the word chasing, but really asking people who are coming to seek for healthcare services to go back home because they do not know how to detect this virus. And lastly, the last time we had, sir, please, the last time we had an update regarding healthcare workers, we had 34 who had tested positive. What's the latest update?
Okay, thank you. Let me start by the first one from Ayub on the question of a public appeal and whether people are adhering to what we are saying. Now, I will continue to make public appeals because perhaps those who had not heard yesterday will hear it today. Because the reason why we make these public appeals continuously is because of what I have just said. This is not a fight for the government. Right? It is not a fight for the government. And in fact, when Steve was talking about an overwhelmed government and they're kind of tied up together, the government is not overwhelmed. You can only be overwhelmed in a fight against something. All right? You can only be overwhelmed if you are fighting a war across the border, which we are not. This is a war against the disease. And the people supposed to fight the disease is not the government. It is you and I. So if indeed we are overwhelmed, it is not the government that will be overwhelmed. It is we Kenyans who will be overwhelmed, because it is Kenyans who have let it happen, not the government that has let it happen. I think that's the first thing to note, that in this is a very unique circumstance. It is such a unique circumstance where the role of the government is simply to appeal to people to protect themselves. The government cannot, it is not a sieve. There is an attack against Kenyans from an outside source, and the government can get its forces and go there and fight. It's not quite like that. There's a situation where the defense force is an individual himself or herself. That is the defense force. So if there is an issue of adhering and people do not adhere, the sufferer again is the individual himself or herself. That's the person who suffers. And you can imagine, sometimes, unfortunately, as you said, watu wa Kenya saa ingine hawasikii. It's a fact. It is because of our indiscipline. And I have said before, and I have told Kenyans, that there are certain countries where they do not have quarantine facilities, they do not have isolation facilities, they only have treatment facilities. The reason being that when a person is told to go and quarantine themselves, they do. And my hope and prayer is that because we have been talking about this thing for the last 3 months, and because everybody now knows that we have a serious situation, and we are faced by a very serious invisible enemy, our supposition as a government is that Kenyans have now become of age, and they have seen what can happen, and therefore, when we say go and self-quarantine, they will self-quarantine. Because if you don't self-quarantine, it's your family that you're exposing, and it's your family that you kill. Let's not, bury our heads to the ground like proverbial ostriches. Let us be honest with ourselves that if people are going to die, they will have been killed by other people. And they will be killed by ourselves, not anybody, not any strangers. Number two, in terms of, Steve, you spoke about the reason why we have 123, because we have over 3,000. That is correct. That would be correct. The more you test, the more you are likely to see the level of infections in the country. It does not necessarily mean that if you test 4,000, for example, in Moyale, or you test 4,000 in a county that doesn't have infections, then you'll get a higher figure. Not necessarily. Because of targeted testing, because we are going to where we have got contacts of contacts of contacts, that is why we are getting the kind of figures that we are getting. We are not overwhelmed. Far, 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 far from it. We continue to increase our capacity and ability to test depending on a number of factors, starting with the availability of reagents to test. Our increasing capacity depends on the global market of supply of some of these products that we use for testing. We are increasing our own internal human capacity to test, both at the country and the county levels. So this is likely to go up. And as it goes up, then we will be able to continue being in a better place to know how far has it permeated, within, outside the country, outside the counties, within Nairobi, within the specific areas. And therefore, in terms of the reopening of the economy, a lot will also depend on some of these variables that we are talking about. And we have to weigh. If there are areas that have no infections, then maybe there is no point of containing those situations. If there are other areas in smaller units that have got a spread of disease, maybe it might be important to contain that specific area. We are not committing ourselves right now to anything specific. We are simply saying that there has to be some sort of balance between activities to keep people alive, socially and economically, and activities to keep them safe. so that we don't all perish. Yes, it is quite possible that we are going to even triple. I mean, if you remember, we started at 500, 100, 500. We are now at 3,000. I don't know what percentage that one is because it is way more than triple. Let me first respond to the issue of KU. Again, we continue to monitor who can pay, who is not able to pay, and quite frankly, we have virtually released any person who has been unable to pay their bills. We just don't want people also to take advantage of our institutions. But clearly, if they are not able to pay, what I can tell you is that they will be allowed to leave. The ability of purity, you are talking about the ability of governors, the ability of the situation in various counties. And I want to put my brothers who are governors of various counties on the spot on this one. The level of preparedness per county is dependent on the ability of the governor of the county. Let me make it clear. We, as a Ministry of Health, we will guide as much as we can. We will provide as much support as we can. But let us never forget that health is a devolved function. And that is why you will see different levels of preparedness at different counties. And I have reported in this presser how we have been how we have admired what some of the governors have done. I mean, imagine with all the figures that we are reporting in Mombasa, that the Mombasa County government is still containing the situation on their own to a large extent. And there lies the positive aspects of devolution. That a governor like Governor Joho and his government are able to deal with so many cases per day. Obviously, the national government is there to assist. We are sending PPEs to him as much as we can with all sorts of supplies from the Ministry of Health. But credit really goes to the governor. And that's why I'm saying that the level of preparedness in a county is directly dependent on the aggressiveness, the preparedness, the planning capacity of the governor and his government. And that is really quite simple. But we are going to go there and we are going to give assistance, you know, as will be needed in the various counties. There are some counties with unique circumstances. For example, if you look at Kajiado, it has got unique circumstances because of Namanga border. If you look at Busia, it has got certain unique circumstances and therefore might require more support because of the Ugandan border. So we will continue to support, but by the end of the day, really it is the county governments that have got also to show some form of aggression in managing themselves. On the issue of PPEs and the corruption that was reported in the newspapers, let me just say this. This is a case that is continuing with DCI. And it is not the only case that is continuing at DCI. There are other cases within this ministry that are continuing. Let me tell you something. This building here, called Afya House, has some very good people. It has got some very committed people. It has got people who work day and night, who work so hard in such difficult circumstances. But this building here has got its fair share of criminals. Like any other marketplace, there are a few mad cases in here. And we will unearth them. As we move on, we will unearth them. These are the people who you call a public officer, who you call a businessman, and tell them that they have got an order which they can help get him with a fake tender. But that fake tender might even have a Ministry of Health logo, because some criminal in here has given that fake logo. it will be those mafiosis who will tell you that you can do a deal with them to supply computers, to supply PPEs, to supply pens, to supply blood. Yes, blood in here. So we know they are in here. And by the way, just to make it clear, the officers that we transferred were not necessarily criminals. That is normal. It is normal to transfer around officials every so often in the ministries, in the procurement sector, in the finance sector. It is normal to change people around. It's just surprising that sometimes you'll find people who have been here for the last 12 years who are not supposed to be here for the last 12 years. This is a sort of place where people get transferred, and then you find they are still sitting here. Why would you be transferred and you still want to sit in that same desk? Wouldn't you be suspicious if you were me? So all I'm saying, people, I am just saying, just like any other sector, just like any other ministry, we have got our challenges here. The only difference is that we are willing to own them up, and therefore we are willing to face them head on. That's the difference. But we are not denying that we have got them here. There are few, just a few bad apples. The rest of the Ministry of Health are very hard-working, honest, God-fearing individuals, and we praise them for the hard work that they continue to do for us. Asanteni sana.